Good day! I'm Camille M. Macanilao, third-year student nurse from Nueva Ecija University of Science and Technology. And for today's return demonstration, I will demonstrate nasogastric tube insertion. For the assessment, check doctor's order. Assess client's level of consciousness and level of knowledge and understanding. Check availability and functionality of the needed materials. Then check for history of nasal surgery or deviated septum. Assess patency of nares. Then determine presence of gag reflex. Assess also the mental status or ability to participate in the procedure. Now for the planning. Before inserting the nasogastric tube, determine the size of tube to be inserted and whether the tube is to be attached to suction. Then prepare for the equipment. Large or small bore tube, non-latex preferred. Non-allergenic adhesive tape, 2.5 cm or 1 inch wide. Clean gloves, water-soluble lubricant, facial tissues, glass of water and drinking straw, 20 to 50 ml syringe with an adapter, basin, pH test strip or meter, bilirubin dipstick, stethoscope, disposable pad or towel, clamp or plug, optional, anti-reflux valve for air vent if solemn sump tube is used, suction apparatus, safety pin and elastic band, and CO2 detector, optional. Let's now proceed to implementation. First, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do and why it is necessary. Good morning, ma'am. I'm Camille M. Macanilao, your student nurse from Nueva Ecija University of Science and Technology. I will be your student nurse from 7 a.m. to 3 p.m. Ma'am, can you state your name?
I'm Jenny Mercado.
And your birthday, ma'am?
January 4, 1999.
Can I see your name band? Ma'am, the procedure we will be doing is the nasogastric tube insertion. We will insert a tube in your nose so that we can gain an access to your stomach so that we can deliver food or medicine easily. Is that okay, ma'am? Ma'am, remember that if you will feel irritable or you're uncomfortable, just raise your right index finger so that I will pause or stop the insertion. Okay, ma'am, let's start. Next, assist the client to a high Fowler's position if his or her health conditions permit, and support the head on the pillow. Ma'am, I will just position you in a high Fowler's position. Now, place a towel or disposable pad across the chest. Next, perform hand hygiene and observe appropriate infection control procedure. Now, provide for client privacy by closing the curtain or closing the door at the room. Now, assess the client's nares. Now, prepare the tube. Then support the patient during the procedure. Next, determine how far to insert the tube. Use the tube to mark off the distance from the tip of the client's nose to the tip of the earlobe, and from the tip of the earlobe to the tip of the side point. Now, mark the tube with adhesive tape if the tube does not have markings. Now, insert the tube. Lubricate the tip of the tube well with water-soluble lubricant or water to ease insertion. Now, insert the tube with its natural curve toward the client into the selected nostril. Ask the client to hyperextend the neck and gently advance the tube towards the nasopharynx. Ma'am, I will insert the tube. Can you hyperextend your neck? If the client gags, stop passing the tube momentarily. Have the client rest, take a few breaths, and take a sip of water to calm the gag reflex. Ascertain correct placement of the tube. Aspirate stomach contents and check the pH, which should be acidic. Confirm by X-ray. Or you can just place a stethoscope over the client's epigastric and inject 10 to 30 ml of air into the tube while listening for a whooshing sound. Now that you hear a whooshing sound, that indicates that the tube is asserting. Now secure the tube by taping it to the bridge of the client's nose. And for the evaluation, evaluate the patient's response to the procedure. Then document the procedure and other important data on the client's chart.
Thank you for watching. Thank you for watching.